uh, Rajat, Dr. Gupta, pain
How you
specialist.
doing?
I'm doing great. My hero are pain specialists. I love pain specialists, right? I always hated that term, no pain, no gain. Quite honestly, I don't want any pain. So, how are you doing in India tonight?
We're doing very well. We are keeping up with good health and saving our environment, saving the people around us. So we are trying to follow the policy of we, like he rightly said. So we are still following the lockdown policies strictly. So doing good.
Awesome. I'm glad to hear that. There's I'm glad to hear too that India took the initiative to say 2 more weeks. Um, and I don't know if you've ever watched the movie 93 Days, but it
I
was
did.
to me it
Fantastic.
it was a true story. It is, isn't it? Right. Um, but to me, it is the true way to stop an epidemic of any kind is the way that they approached it. But also the mindset of it, it's really going to take 90 days. That's what I kept saying in the very beginning. 2 weeks, 3 weeks, 1 month is not going to get this. We need a full season to heal, a full season to get a grip around what's happening, understand it before we even go back. And one of the doctors even wrote, why can't we wait until we see zero new infections?
Yeah.
Wait it out 1 week, zero new infections. Then we start with ground zero, right? And then gradually we go back. But we're too eager. Do you feel like the mental state of minds are going crazy, Dr. Gupta?
Yeah, definitely. And it's like when you try to fool a kid. If the government comes and says that you're locked down for 90 days, it's impossible for people to stay at home and they'll go crazy. So it's like 2 weeks, you keep reassuring and you keep pulling on. So this is the trick they're doing. So eventually it will extend till 90 days. So the day it started, we expected it to go on till June, and that's where we are heading to. So I think they're just playing with the psychology of people and keeping us calm down with the hope that after 14 days, we'll be back to normal.
I think, but do you think some people go, well, you've told me 2 weeks for too many times, like that movie Money Pit? And he goes, 2 weeks, 2 weeks, 2 weeks, you're sounding like a bird. Um, you know, do you think people are getting tired of hearing 2 more weeks?
You know, I'll be very honest. People are definitely getting tired, but our leadership in India, Mr. Modi, our Prime Minister, is very very smart and very down to earth and connected by the general public. So the way he communicates himself, the way he comes out with the ideas and the policies, general public relate. And he was a common man. He was a tea seller, so he can understand the mentality of general public, and people do appreciate him and do listen to him. There are few people who don't listen to anyone, so they do come out on roads and they do don't follow the rules, and that's why we are here having huge numbers.
I think eventually we're going to have to come down to some law enforcements for people who can't abide by the rules. Like, I have issues with people coming to work sick, and that has been the biggest problem for years. And now, if somebody comes to work sick, they cannot just make me sick, but they could kill me, as far as I'm concerned. But what is your opinion? I mean, as a doctor, what is your opinion on a lot of testing, maybe even daily testing for early detection?
See, as long as you have the backup and you have the infrastructure to do that, you have the kits, there is no harm in doing it. But again, it comes down to shortage of supply and faulty kits. So because people are feeding in with a lot of kits just to earn good money, there are a lot of faulty kits coming in. So there are very lots of false positive tests also, or false negative for that matter. Like few patients were tested negative on a rapid testing kit, which came out to be positive on RT-PCR. So like, what are we doing? So we are creating more of confusion and distrust on the medical facility as a whole. So I think in that we should have strict rules and regulation, and we should not rush for testing. and we should have proper certified testing kits, and
I
that's the
agree.
way to go. Yeah.
Certification kits, I think, too. So I think that they should be like staged. If you're getting tested and you do find that you're tested positive, then you take the next stage testing just to confirm positive, right? So I think, but certified kits, I think, um, I'm trying to understand how are so many faulty kits coming out. I mean, there's certainly got to be a reagent. It's a reagent, right? A chemical that it's a little bottle. Ankit and I have seen the kits, and but all of this chemical has got to come from the same vat somewhere, or somebody mixes up the same chemical. I mean, why would somebody generate faulty kits?
See, I don't know. There are people who have the mindset of earning money. Moreover, there could be strict temperature control, which probably we are not able to do for the
Ah, yeah,
reagent.
that's good.
And in different countries, we have high temperatures. I don't know how the kids are lying, what facilities they are in. So we really don't know how and what's going on. But we are sure that the kits are not 100% right. So there are faulty kits coming in.
Wow, that's well. Hopefully, we'll put an end to that. But let's talk about some other positive things because you are a pain specialist, and this is your area of practice. And this is a doctor that I just like really am thankful for because I live in chronic pain with a disease. But what are some of the changes that you've seen on how you have to practice with your patients today?
So the biggest change which has come into medical practice is telemedicine, teleconsult. So which is going to live with us like COVID is going to. So this is something a new boom in the field of medicine, and we as doctors are enjoying it with its limitations also, and patients are getting familiar to it. So it's very convenient for the patients, and it's very convenient for doctors as well. And so we are enjoying it. And follow up on telemedicine is easier. It is difficult to see new patients on telemedicine. So this is how things are going. This is the new things which we are doing.
Are you finding it though, even though it's easier in some ways, maybe a challenge because you can't physically see the patient?
Yeah, that's what I said, that new patients are difficult to be seen on telemedicine. But yeah, follow up patients are patients who are cancer pain patients who are on regular doses of opioids. They just need a refill. So it's easier for them. We send they consult the prescription directly to the pharmacy, and they can collect the medications from there. So it becomes easier for them.
All right. And in my case, unfortunately, because of our country, I cannot get my refill on any opioids without physically seeing the doctor. So I still have to physically, even though I've had a chronic disease since 1998. And I don't abuse them. I use them just when needed, but that can be a challenge. Is it, in your country? Also, like physical therapy is very important to me for pain. How are you handling that with some of your patients?
So as of now, we are just focusing on asking them to exercise on their own. We are forwarding them videos and charts, exercise charts, which they can copy and follow, because we are not advising them to go to a physiotherapist or or a chiropractor for that matter and do live sessions. Or I can even put them in touch with physiotherapists who can do again tele consult live sessions on video. So this is how they're trying to manage.
It's so odd to me because I'm so used to that physical meetings. I think there's something to it mentally for me. The telemedicine has just been very difficult for me. I do it because I need it. One of the things I found with pain is I went to a pain psychologist for a while. It wasn't a full term, but it helped me understand me, my pain thresholds. um, I don't know if that's something that you practice, But it didn't mean I was crazy. It didn't mean anything other than I just didn't panic, right? And I learned to deal with it. Rest is very important in this time, isn't it?
So here in India, I was trained from McGill, Canada. So I learned the technique of interdisciplinary pain clinics. So we used to have a pain specialist with a psychologist on board. Together, we do an initial consult for new patients, and if the psychologist feels the need for the patient to be seen by him or her. So they take a different appointment and see a psychologist as well. So I'm trying to follow the same culture here in India. So we do involve psychologists and if needed a psychiatrist later on if it's not managed. But a lot of patients are very well managed by psychologists, and especially the cognitive behavioral therapies are doing wonders for chronic pain patients.
I found a huge difference. My whole way dealing with pain and everything just changed completely. My ability to sleep better. You know, I have my days, right? We all have, but we all have bad days. This is what I finally, we all have bad days. But I found that I could put myself to sleep better, sleep. I just found a completely different way of accepting the pain, as opposed to fighting it and being depressed with it. So I think that I'm glad to hear that you do the both. I think they're both are very, very important. And like you said, not everybody needs it, right? You banged up your knee really bad, you're in pain, you get your surgery, you heal. You might not need a pain psychiatrist, but the chronic ones. Well, I have a question, and this isn't to be a bad question, but we have an opioid overdose problem in our country. Is that a problem in your country?
See, in India, first of all, we have very restricted permission for opioids. Like in states and in Canada, we have oxycodones and hydromorphones and oxycontins and everything available. Even the methadones are easily available. In India, we are mostly familiar with or available with fentanyl and morphine. So are not much. And moreover, in India, we are not using opioids for chronic pain patients. We are mostly using opioids for cancer pain patients.
Oh, wow.
Unlike unlike states, where we are using it for chronic pain patients as well. So if you are using opioids for cancer pain patients, the chances of addiction and overdosages are very less. But in chronic pain patients, the chances of addiction and overdoses are very high. So that's why we are not dealing with a lot of overdosages, and it's not an epidemic in our country as such.
Well, that's an interesting mindset. I
Yeah.
don't know that anyone's ever talked about that here. Because it's such a huge problem, and we are such a bad reactive country rather than proactive. But that's an interesting way of looking at it. To separate the two like that. That's very, very interesting. I would love to see that conversation be managed here as well. So, what are some of the things that telepathic? I guess do they call it
Telemedicine.
okay, telemedicine? What are some of the things that your patients are they happy with this as well?
See, it's new for all of us. So when we started, it was very unusual. It was like explaining the same thing 4 or 5 times and recording the whole session. Then, because at times patients tend to not uh, understand what I'm saying and tends to say that and then sending the prescription across uh, scanned version. So people are not familiar with. They don't have easy access to printers here in India. Not everybody has a printer set up at home, and I'm talking about people who come from rural places. So in metros and in bigger cities like New Delhi, we have access to printers everywhere, but not everybody has access to printers in the rural villages. So people who are coming from those parts had it's very difficult for them to understand the concept of how can you see me on phone. So that's very interesting. But gradually we are learning, we are improving, and we are able to convince them better. They are a little more reluctant in paying their fees for teleconsult, like paying so much of money just for 10, 15 minutes. So it's a little unusual for patients. But again, the whole concept is going on, and we are improving on that. Everybody is. We are learning.
Well,
Yeah. So when we talk about pain, how important or how what is the role of willpower of each and every individual to bear that pain? Because a lot of times, especially in the cancer patients, they have a lot of pains, and if you inject a lot of medication, still they have that pain coming over now and then. So, how important is the willpower in playing a role to maintaining the pain in the body?
See, pain is a very subjective feeling, and what you perceive as pain, I might not perceive it as pain. So it is the brain that perceives pain. So it's like training the brain. So people who have strong willpower and strong will to be fine and strong will to be okay, they
Yeah.
definitely perceive pain lesser than people who don't. And this is why a role of a psychologist come into play. This is what he or she trains the brain. Distraction therapies like listening to music, distracting, going for shopping. So it eases you down, calling guests on, doing what you like to do. So you are trying to distract your brain. So your brain doesn't focus all the time on pain.
Yeah.
So this is how these are adjuvant therapies, which is helping us in controlling chronic pain patients. And in cancer pain also it works wonderfully. But again, not per se, not alone as a therapy. You have to combine it with medications and physical therapies and psychological support. So it is a multidisciplinary kind of an approach.
no, I think you're right there too. You just, it is subjective. Each
Yeah.
person is different. Thresholds are different. I will tell you this. I'll be doing fine for a while because of the treatments I get. What I have is a considered a tumor or a cyst in the spine, but and I really work hard at not taking the opioids unless I have to, right? It's just a promise I made myself. But when the treatments wear off, I almost feel like the pain is worse because I haven't had it for so long that it's very like, oh my God, it's like getting hit with a baseball bat, right? It seems worse than it was previous. And I go, are the shots really worth it? Are my treatments really worth it? Because when it wears off, it hurts really, really bad. So I think you're right that, it is subjective and different for everyone. What are,
Do you also see a difference when a person is doing a lot of work, he's busy in the work, they have less pain as compared to a person who is sitting idle and just thinking about the disease?
Ankit, I always say pain is like a mosquito. Have you ever
Yeah.
noticed mosquitoes bite at night? Why don't they bite in the daytime? Because when you're lying down in a bed and you have nothing else to do, then you feel mosquitoes biting you. Similarly,
Yeah.
pain. When you're busy and you are distracted, you don't feel your pain. But once you go back home,
Yeah.
or to people you are not comfortable with, or you
Yeah.
don't like to be with, there are a lot
Oh,
of factors. So
yeah.
you definitely feel more pain.
It's all about the mind game then, I think.
Yeah, it's all about training the mind.
you know,
Yeah, it's all.
you're right too, because everybody asks me, how are you getting on and working all day long? But how do you live with what you have? Even my doctors for years could not understand but I go to work every day. I just don't, I don't think when I'm at work, I don't think about it. You're right. I'm there and I stay busy, but when I get bored,
Then
I start going, oh, I don't feel so good. I want to curl into a bed, But yeah, I know you're right. It's definitely having something to do, not thinking about myself, but thinking about everything else is definitely. I will say this: I'm very, very tired at the end of the day, and when I do stop, I go, oh, I hurt, and everybody goes, why do you work so much? But I didn't. It didn't feel bad while I was working. I don't move a lot either. So that, and I know when to slow down, and Kit can see it. I know kind of when I have to pull back a little bit, but I think you have to have something mentally to do. But how do you convince somebody and I mean, I know how I convince myself because I'm afraid I'll never walk again. But how do you convince people? That's got to be your toughest job, is convincing people Yes, you live in pain. Yes, it might be like this the rest of your. How do you convince them to get out there and do it? Just do something.
See, it's again a trick. It's again like our everybody's doing about COVID. 2 weeks, then 2 weeks, then 2 weeks. Okay, so it's the same policy. It's like 15 minutes walk out of home and 15 minutes back. So just walk for 30 minutes in a day. So if I tell you to do that, 15 minutes is like nothing. You're like, okay, I can walk 15 minutes out, and then if you go out, you will have to come back to your house, right? So you will walk 15 minutes back. So 30 minutes doesn't look much. If I ask you to walk for 2 hours a day, you will never walk.
No, you're right. I have this book called here. This is my favorite book. This is how when I get off track, I get back on track because there's no excuses. 8 minutes a day, right? There is no excuses for 8 minutes. And all it is stretching and running in place. Run in place for a minute and stretch. You know, after you do this a while, you go, oh, I can do more. Like you said, I can do more. I can do more. But it's my guilty book. Every time I get off track, I go, I can do 8 minutes. Yeah, I can do that. So you're right. It's a mental thing. That explains.
That explains 2 weeks lockdown.
Yes.
I said that explains 2 weeks lockdown.
That
every
does
2 weeks.
It does. I just think, you know, people are going to get tired of hearing that. When I was mentally prepared that I might not ever walk again, but that I had to lay still, and they told me I was going to be incapacitated. I'm going to tell you what, I had no idea what that meant. I mean, in my mind, I thought, just lay, but I couldn't move my arms or anything for 3 months. Not 30 days, 60 days, 3 months. And you think you can mentally handle it, but I want to tell you what, it was very, very hard. It was very, very hard. But you know, it gave me something to look forward to because I said, well, on the 90th day, by God, I'm going to be up walking, right? It wasn't that easy either, folks, because what happens is your muscles deteriorate. So while you're inside, it doesn't mean you go inside and you just stay inside. Get outside a little bit, get the sunshine. Like he was saying, go out and walk for 15 minutes. That's something I've been trying to convince my son to do because he's up in New York, but he's not in the city, thank God. But he just moved up there. But I'm like, just 15 minutes in the sun every day. Get outside, do your exercises inside. If you're not comfortable, you know, people who go to the gym, find like that 8 minutes a day. Guilt yourself into doing 8 minutes a day. Self-challenging, you know, that's something else. We're going to start a physical fitness channel, but maybe even somebody like you who can just, like you're doing today, just get it, do it. There's nothing stopping you. This is what I tell people. You're at home. That 1 hour of driving back and forth to work, you're not doing that now. Work out. Put an hour into working out. You know? Instead, in my life, I ended up working extra hours, right? I'm on TV more than I've ever been. You know, Ankit and I counted, we've done over, probably we're at 250 shows now.
More than that.
Yeah, because 1 hour shows constitute as one episode. And so we've done over 250 episodes.
That is also within 60 days.
Within 60 days. I don't know of anyone who's done that. I really don't. Even Nick. Nick is like, I cannot. Because we are exhausted after an 8 hour day on set. We are just wore down. And to do as many as we've done. So, you know, it's inspiring to me because I'm like, I did it. Yay, we did it, right? And that's what, you know, you got to have those reward moments, right? With your patients. Your patients have to be rewarded. Rakesh, do you live in pain?
Yeah.
Yes.
Shoulder pain and things like that. And
I was thinking about a case of a lady in the UK who didn't feel pain at all. And they discovered it when she had a baby.
oh yeah.
Oh.
You know, and the doctor said, you know, push, and she was doing all that had to be done, but she didn't feel pain at all. And I was thinking about how pain is one of our warning systems. You know, if we look at a body as a defense system, it's a kind of our warning system that, hey, don't push me. Yeah, that kind of thing. So from a point of the other thing you're talking about, the opioids, Um, yeah, in New Zealand, there's a strong pro-opioid movement. I don't know that much because I've left India now almost 25 years. So, although I do visit off and on, I don't know much about what's happening in India. But in New Zealand, there's a strong I think it's no longer a crime in New Zealand to have uh, CBD. You call it, I think.
Yeah,
CBD.
cannabinoid,
Yes,
cannabis.
CBD. So it's not a crime in New Zealand anymore. Uh, I think if you deal in it, it's a crime, but otherwise to just possess it is not a crime. Um, and in terms of COVID, you know, I keep thinking of that lovely lady who came on show from Georgia, you know,
Laddie.
with Tylenol and how she handled it. I mean, this was just wonderful. Uh, I don't know much about Hong Kong and how, but I don't think that we're doing any special treatment for pain because of COVID. Uh, we have, well, I sort of hurt my back. They said that I need to wear some kind of a thing which I have to wrap around my torso, and that was it. they 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 did give me some very powerful painkillers, and I refused to take it. I said I'd rather just have a support because I believe in the early warning system. I don't know whether I'm a masochist or what.
You made a valid point there, and I lectured this in court one day because I was trying to get disability because of my disease, and was told that I should never work again. That's what they told me. I just really shouldn't work because of how dangerous the disease is. It's not contagious, but to me, I told them, I said I can live on drugs, but I'm not going to have that warning of when to stop. And I might re-injure myself because I'm thinking I'm fine because I've done that before. I'm fine. I'm okay. I can go do this. And so I did something and I fell and I broke my arm because I was doing something I really shouldn't have been doing. I was doing that something I shouldn't have been doing because I was like, woohoo, I feel great. I feel fine. I'm super mom. I don't have a disease that's going to kill me if I, and I fell and I broke my arm. And my doctor said, well, what were you doing? And I go, I was feeling great. and he told me, he goes, just because you feel great doesn't mean you can go out and do these things. Your body can't do, you're physically, they told me I was physically great for the problems I have. But threshold is important. What do you think, Dr. Gupta? Pain threshold is important.
Yeah, for sure. For sure, pain threshold is the major thing. And like we say, diseases like fibromyalgia, there is a lot of decreased pain threshold. So even the touch is being perceived as pain by the body. So that's why such patients are in a lot of pain all day long. So yeah, pain threshold is the key. So that's what it's like training the brain, raising the bar of pain threshold back to normal. So that's what as pain specialists, we're trying to do.
Yeah, so there's that.
I have a question from a viewer, and he wants to know that how a mental pain is different from a physical pain.
How to tell the difference? Mental.
How a mental pain? So people have mentally they're disturbed, so they are having some pain inside their body, which they are not sure where it is, and it's different from a physical pain. I'm not sure, but that's what they want to
see.
I can only explain that mental pain is probably what we call as stress.
Okay.
That's called the mental pain. And physical pain is like bodily pain because of arthritis, aging, overuse of your body. So, yes, stress can increase the physical pain, and physical pain can increase the stress again. So it's a vicious cycle. So both go hand in hand. So if you have a physical pain, you can have stress, and if you have stress, it can lead to more of physical pain.
So yeah, and I found that if I think I'm sleeping sometimes, but my doctors told me that you think you're sleeping, but your body's not really resting. You're still having, and so occasionally I've had to take things to help me. Even though I felt like I was sleeping good, I kept going, I just don't feel rested. And they go, that's because your body's fighting the pain while you're sleeping. So your body's never resting, and that's why it doesn't heal. And I think that's why so many people suffer and struggle so much. And so when I finally agreed to take the medications at night so that my body could rest, I actually started to heal. I heal a lot faster. So you can think you're sleeping, but your body's not. And I found that to be very impactful in therapy to understand that. Um, you know, and the thing to do is get doctors to come in and help, right? Good doctors, go see your pain doctor, Dr. Gupta. That's what they're there for. That's your practice. Don't be afraid to go. And even if you think it's all in your mind, that's when you really need to go see somebody, right? Make sure it's not just in your mind. I had my doctor one time say, no, Kim, it's not in your mind. It's exactly where that pain is. I tested it. You got pain. So I'm like, okay. So that's important. So you studied in Canada as well, or you practice in Canada?
I did practice in Canada for a couple of years. I was trained from McGill University, Montreal. I was in Montreal for a couple of years. I did work in US also for 5-6 months. I was doing my clerkship internship there at Cleveland Clinic, Ohio. So I've been exposed to the Western world. So that's when I started uh, thought of becoming a pain physician. So I was an anesthesiologist who super specialized into pain physician.
Yeah, that's a good transition to understand all of the anesthesia that goes into the body, the drugs, how they react in your body. I mean, that's a good transition. What do you find? Do you ever find some good alternative means of deferring pain?
Sorry, good alternatives to?
Yeah, do you have any good alternative practices that you like to use for deferring pain?
I think music is the best therapy.
I love
Trust me,
it.
music is the best therapy to defer pain. Apart from that, meditation, yoga, they are very, very good therapies to distract pain.
Now, those are probably the two. I agree with you. And they don't cost you anything, do they?
They don't cost you anything.
It's free. So, but anyway, we have another doctor here, Dr. Roll. Welcome again.
Hello.
Hello.
Yes.
And how are things in where you're at today?
Things are good, as they are always.
That's always good. The doctors are always happy on our show, aren't they, Kit?
Yeah, they're always happy. They are always motivated, and they know how to manage these kind of situations. I think they are superheroes.
They are all very superheroes because even if they're not dealing with COVID in itself, they still have to treat patients. They still have to be with people, even though they're using the telephone more. You still eventually have to interact, and so all the doctors are definitely heroes.
And I think the best part is they're always ready because they know that in their profession they have to be ready 24/7. So I think they're always ready to take the call, and that is the best part because if you call me at any time, it might be difficult. I will just see how I can dodge it, but I mean they are always ready to take those calls. So I think
Well,
salute to them.
Thank you, Ankit.
Thank you.
Yeah, salute you guys because I think that you definitely serve us. But the thing is you guys have such a great. I feel like I missed a job opportunity by not going into medicine. My mom kept telling me go into medicine, and I'm like, oh, well, that's just so much studying.
And with medicine, Kim, I have one more question from a viewer. And so in India, people generally, whenever they have a pain, they generally take a paracetamol, as Dr. Rajat aware about. So how good or is it good to have the daily dose of paracetamol? I mean, does that impact your body at some point of time? Because with a small headache, they start taking paracetamol, and and also whenever there's a body ache and things like that, they just take a paracetamol medicine. What do you think, Dr. Rajat?
See, paracetamol is, as a pain physicians, we call it as a candy. Okay, this is the safest medication in the world.
Okay.
Anybody can take paracetamol, but what is important is if you take more than 4 grams a day, that is more than 4,000 milligrams a day, you are tend to damage your liver. So you have to be cautious. Secondly, it is very important that you don't routinely take paracetamol, especially during this COVID period, because if you have symptoms, that will be masked if you take paracetamol. So if you are having body ache or malaise or fever, because if you take up paracetamol and board a flight and you get down at India or any other country, you will not be screened. They will not show you fever on thermal scanner. That's what people have done to skip scanning. So
That's
because
interesting. Wow.
because paracetamol is antipyretic medication. It's used for fever also and for mild analgesia. So though it's safe, but it also tends to mask symptoms. So you should not take it during an epidemic. Like right now, if you are taking paracetamol daily, it's in the need that you go to a doctor and show, because that's not normal.
So can
But
you
otherwise, as a routine,
spell it
it's
out
safe.
on our banner so people know what it is? Can you
Yeah.
type it up so that we just let people know that it's not a good thing to be taking during a pandemic situation? That
I would say avoid any medication during epidemics without a consult.
Oh, without your absolutely.
For that matter, any medication.
So, Dr. Rajat, in case of some pain, maybe or a severe pain, what is the one medicine a person can take if he's not able to reach out to a doctor? I'm not talking about pandemic. Generally,
you can definitely take paracetamol. You can definitely take ibuprofen. They are safe medications. Ibuprofen you can take, but again, it depends how frequently you are taking it. Like ibuprofen tends to damage kidneys, tends to give you gastric ulcers, or if you have high blood pressure, tends to increase your blood pressure. So you need to know your medical history. You just cannot take it. There is no simple medication which the simplest medication which can be taken as a routine is paracetamol.
Okay.
Which anybody can take, even a kidney patient, even a liver patient, one tablet, but he cannot take it, cannot keep taking it every day.
No, I agree. That's very.
There's one more medicine which is close to paracetamol and which is also very popularly used in India, which is known as Combiflam, which has some paracetamol with some other salt. Is that also?
So Combiflam has paracetamol plus ibuprofen.
Okay.
Now it's not safe because you can take Combiflam once in a while, like one in a week or one in 10 days, but you can't take Combiflam every day because Combiflam has ibuprofen also.
Okay.
So it can definitely affect and damage you and damage your kidneys.
Okay.
But plain paracetamol, 650 or 500 milligrams as per the age and the weight of the patient can be taken as a simple analgesic. But if you require it every day, then you need to show to a doctor. But do not take any medication without a consult, especially during pandemics.
Okay. And we have one more question from Mr. Rajkumar Jain from Mumbai, and he always used to join us on our show. He wants to know about Dolo 650.
Dolo 650 is paracetamol 650. So it is the same thing. That can be taken.
Okay. Great.
Well, this is good information. I would have not thought about some of these problems with the medications, and I should have. I mean, this is something good to know, especially if we're going to be doing some talks with pharmaceutical companies to understand these things. But we definitely don't want to be masking our symptoms during this time frame. So absolutely. I'll tell you one thing I have found is just, even though I've been trying to get exercise in every day, I tend to be fatigued. And I don't know that I'm stressed out over COVID. Maybe I am. Because I live out in the country anyway, so I'm kind of used. But no, actually it's not true. I'm used to traveling 85% of the time. So this is kind of bizarre for me to be home, but I'm not allowing myself to be locked in. But I find myself fatigued. Is that a common problem?
See, the reason for fatigue is lack of sleep, first of all, and lack of sound sleep. Like you say, you are sleeping, but your body is not sleeping. So it's not the body; it's the mind that is not sleeping.
Okay.
So there's a need to have a sound sleep. Secondly, exercise is very important. Physical exercises is very, very important. If you don't use your muscles, you will tend to feel fatigue. Thirdly, diet is very important. So you should have a good protein diet and lot of water,
A lot of
liquid.
liquids. I think I've kind of been failing on that lately. I'm not drinking as much. Ankit and I used to compete, but we stopped. So maybe I need to start doing that because I noticed my cups are still full at the end of the show. I try to bring in a bunch of different kinds of hydration. I bring in lemon mixed with water, tea, just different, nothing soda. Ankit and I have a rule, no soda. Otherwise, we'd be doing belching contests. but I appreciate your tips. Are there some things you would like to share with the viewers while you're here?
Sorry, that was for me. I didn't hear.
Yes, I'm sorry, Dr. Gupta. I was just wondering if there's something that you would like to share with the viewers about what they can be doing during this time frame, just to let them know they're not alone.
Yeah.
Just be positive. We'll fight it out. We'll start living with COVID, and it's going to be like a normal influenza or a normal viruses. Everybody will get infected. We'll develop the herd immunity, and we'll start living with it. So it's going to be a part of our life. Nothing will stop. It's just a phase, and as doctors strongly advise not to take medications without any consult. And this is a beautiful channel running on, so you have everything on board. I can see a lot of entertainment as well as education, so it's a good mixture of everything. So keep logging in, and you'll get the best.
Thank you. And I want people to know that if you're feeling and having problems and can't figure it out or need some help, contact us at Go Live at IBM.TV. Ankit and I are really, really good at helping people find solutions. We've even helped doctors find PPE equipment. They weren't able to get PPE equipment, so we've kind of connected some dots for them. But you don't have to be a doctor to call us for help. If you're a person out there with chronic pain, reach out to us and we'll connect you with Dr. Gupta, and you can ask him direct questions. So, thank you so much. So,
and I think to reach, if our viewers would like to reach out to Dr. Gupta, so they have a website called orlinclinic.com, and they can reach out to Dr. Rajat Gupta at orlinclinic.com. And I think Dr. Gupta is ready to serve people around the world. So let's stay blessed and hope everything will be fine as soon as we can.
That's right.
Thank you, Dr. Rajat, for joining us today.
That's right.
Take care. And also, before you go, we have seen a different look of yours from what we had in the past. What is the change makeover?
Yeah, what is the change?
So I have not cut my hair, and I've colored my hair.
Okay.
You did your own.
So trying to look different. So
Okay.
we need to be motivated.
I love it. You're looking great. Ankit's been doing his own hair, and I like it. I like it. Self barbers. I love it. Colored your hair. I haven't done anything to mine. I've just let mine keep growing because I'm not going to go see the beautician, and I'm not coloring it, so it's not blonde anymore. So I get it. I get it. It's different, but
Thank you.
It looks good. You look great. I love
okay,
it.
Ankit, I'll take you.
Patient's age is 85. I know case. What is hemiplegia?
So this question is for Dr. Rajat. I mean, before you
Oh,
go.
another doctor. Okay.
So L4, L5 is fractured and having pain in the leg continuously. Can't take much painkillers. Kindly advise pain medication. Now, the thing is that this patient needs to be seen in person. I can definitely help the person. I can definitely help the patient because the heart is working 30%. I cannot just prescribe medication over phone. So definitely would like to examine the patient and see all the reports. But definitely I can help with pain. I have painkillers which are safe in such patients also.
So I think we can request Mr. Rajkumar Jain to get in touch with Dr. Rajat and
Yeah.
then
Absolutely. We'll connect the dots. You know, this is what I love about this show is we're about the solutions, right? We're not, you can complain, but we're about finding the solutions and talking through it. And we want to help find the solutions for people who are out there suffering and maybe can't get to your doctor. You know, again, we're not like 100% everything. We always say consult your doctor, but we've got great doctors here and everything. So, and Dr. Stu, hello.
Namaste.
You look different today. You look different. You got a different hat on. I love it.
Yeah. So
I'll take your leave.
this is just
Okay.
yeah.
Dr.
It
Gupta.
was nice to hear you, Dr. Rajat. So
Thank
the
you,
valid
sir.
point, I was listening when I was on backstage. So I think for the pain management, it is nowadays it is a very good field if you can take care of the patient's pain. Thank you so much, Dr. Rajat.
Thank you. And thank you for sharing with us some of these great ideas because, you know, when you're sitting at home in pain, it's hard to motivate. So I appreciate your time. Thank you.
Yeah. Hi, Dr. Rahul.
Dr. Rahul and Dr. Sagu. I